if you grow up in certain neighborhoods, you're going to feel stress. That's just, they know that, I know it, and you know it. Now the question is not whether you're going to experience stress, it's how you're going to handle it. Since we know in a generic way the risks that these young people are going to face in a neighborhood trying to grow up. We may argue on percentages, but we know what they are. Now then, since we know that, then beginning in elementary school, in the Boys and Girls Clubs, in the churches, wherever these children are, we need to teach what is now being labeled as resilience training, giving these young people some of the strengths and skills that they will need to face what we know that they may have to face. Right. And so they're trying to teach these kids problem solving, opportunity finding skills, resilience, how to bounce back from setbacks, and they're incorporating the 7 strengths, although they don't call them that, but that's what they're doing, before the problem starts. So that's balancing the protective factors against the risk.
Philly for Life is based on the tenets of leading Black psychologists and psychiatrists, such as Dr. Joseph White and Dr. Carl Bell. Me infused their knowledge, scholarship, and science, and their commitment to seeing Black youth succeed in spite of the challenges posed by this society to build this strength-based tool. They taught us that when people harness their resilience, they can overcome challenges and immediately improve their mental health outcomes. A key strength Dr. White focused on is connectedness to caring adults. This protective factor is a core element of Philly for Life. That's why we are recruiting and mobilizing what we are calling adult allies.
Now, the missing element in the Black community is the mentor. A young boy needs hands-on guidance to guide him from age 8 into adulthood. He needs hands-on male guidance. And if we do not provide healthy mentors for them, they will find mentors where? In the streets. That's right.
The protective factor skills that will allow Philly youth to focus on living and thriving, rather than on merely surviving day-to-day community violence, are delivered and reinforced through dialogue and interactions with their matched adult ally. The triggers for these conversations are embedded in the digitally delivered video lessons and easy-to-use postcards that deal with the daily realities of poverty, racism, and chronic trauma.
Now, then we start discussing with these kids what are some different ways of handling stress. They know what they are: drinking, drugs, sex, beating somebody up. And then we say, well, now what are some constructive ways? And get them talking with us and saying, okay, well, now this therapy may help you discover within yourself some constructive ways, because these other ways may be making the situation worse for you.
We can't overstate the critical role that adult allies will play in Philly for Life. They will guide you through trauma-informed lessons that address how to react in crisis situations without resorting to violence, how to infuse mental wellness practices into everyday life, why having a life plan and even a plan B is so important, and how to navigate systems so that they can access the services they need and deserve.
What are your goals? The kids have no trouble, even some of the kids in the Youth Authority, when I asked them, where would you like to be in 5 years? What would you like to be doing? Then I slide in there, what are some of the things that might get in the way of that? What are some barriers outside of you and inside of you that might get in the way of your dream? And once they begin to talk about the barriers, inside and outside, then I ask them, well, what kinds of strengths will you need? Or what do you need to overcome these barriers, whatever they might be? And that's when I slide the mental health piece in.
We are looking for caring, non-judgmental Philly adults who see our teens' strengths and potential, not just their challenges and issues. Are you a protective factor? If so, we need you. Get trained now so you can join us in Philly for Life.